Right, I'm going to ask you actually, could you just pop your hands up if you genuinely had heard of Healthwatch before you walked into the room? Fabulous. Okay, well, you're a very well-informed audience. And can you put your hands up if you've been in touch with your local Healthwatch? Very good. Okay. Oh, this is looking encouraging. And anybody who's actually actively worked or is indeed working with or working in a Healthwatch? Okay. That's the number we're going to need to improve, but it's a good start. We are, as you say, a brand new player, a very small player. I was struck by your 2.7 billion going anew into public health. There's 45.3 million gone into Healthwatch. I cannot possibly do the mathematics, but what that means is it's a tiny fraction of this huge bit of spending, but we have an absolutely critical function, which is actually to stand by the sides of consumers of health and social care. So I'm just going to talk through who we are and who Healthwatch is at a local level so that we get more hands next time I come back. And give you some glimpse of the framework and the platform for action that we launched 48 hours ago when we launched our first ever annual report. So this is who Healthwatch England and the Healthwatch Network is. Between us, we have coverage for all children, young people and adults in England. And we cover health and social care together because we were born out of the Health and Social Care Act. One of the really important things for us is that we've got health and social care together in our DNA. It's absolutely built into us, enabling us to look at the whole person, which makes public health such a critically important issue for us, and where public health audiences get us actually much more than many other audiences we speak to. It's roughly in this order at the moment: public health first, social care second, health, traditional health, finding it a bit more challenging. So well done, you're well ahead of the curve on all of this because you understand the whole person, and that's your starting point as well. What we have as Healthwatch England is power to escalate concerns. So we have statutory powers over a rather formidable range of bodies. My background is the voluntary sector. I've never had statutory powers before, and I have to say I'm rather overexcited by the notion of statutory powers. It means that we can advise monitor NHS England, every single local authority in the country, and the Secretary of State himself, where we've got concerns about whether people's needs are actually being met within the system. Local Healthwatch can report their concerns to us. If they don't feel that they're being properly resolved, we can take it right up to the very top. So they don't have to take on our advice, but they have to respond to it publicly. And we think that that's pretty powerful and will prove pretty powerful in time. So we've got new powers at a national level. We also have powers to conduct special inquiries and reports. So we've got those powers. Local Healthwatch have also got new powers. So we've got 152 local Healthwatch across the country, meaning every single person in England is covered. If you don't know where your local Healthwatch is yet, all you need to do is come to our website, healthwatch.co.uk. You type in your postcode and you can find it out, and do be in touch. I went to my local Healthwatch specifically to tell them to behave themselves, because if one is going to go wrong, I really hope it's not in my backyard. But I am very proud to announce that I live in Lambeth, and I went to the launch of Healthwatch Lambeth. They're already doing a fabulous job. Like many of the launches up and down the country, it was standing room only. It was in the summer. It was a baking hot day, and people had turned up, literally more than 100 people had turned up in order to find out about this exciting new body. So given this is the very germ of an idea, what's fantastic is how excited people are already about this at a local level. But we know we've got a lot more to do to raise people's awareness, because if at a local level, if at a national level we're going to be effective, and at a local level people are going to be effective, we really need to make sure people know that there's a new champion who is there for consumers of health and social care. Because one of the critical functions that Healthwatch have locally is to provide information and signposting. Sometimes they provide complaints advocacy as well, depends on how that's being commissioned locally. But in every single circumstance, they are there to stand by consumers' sides and to point them in the right direction in what is an incredibly complex landscape. And as Tim referred to already, critically, they have also a statutory place on the local health and wellbeing board. And what that means, our interpretation of that, is that they are there to shape services around consumers, with consumers' needs in mind. Too long, we've had a system that is responsive to professionals or institutions, and quite often what gets forgotten is actually what do people need and want from the system. And this is the huge potential, the transformation in Tim's terms that we have by having not only health and wellbeing boards, but a consumer champion with a statutory place on local health and wellbeing boards. I believe there's nothing like seeing it, so I'm on the Cook's tour now of health and wellbeing boards because I've sat in lots and lots of meetings where people have talked about health and wellbeing boards, and I ask every time, have you actually been to one? And people say no. So I'm saying no so far, but next week I go to my very first, and I'm going to go, so I'm going to Lambeth, I'm starting close to home, I'm up to Leeds, and then I'm going to choose another one just to have a flavour actually of what does go on in a health and wellbeing board, how open and transparent really is it, how influential are the people around the table. I'd encourage you all to do the same. I'm sure many of you are there already. So what we're going to do as we become fully established and Local Health Watch become fully established is really work together to deliver change for people who use health and social care. And this beautiful diagram shows you how we can take local insight to make national impact. Now, this is a wonderful Health Watch story because I was at the launch of Merton Health Watch, again earlier in the summer, and they said, we have local insight, you at Health Watch England have national impact. And I thought, that is so brilliant, I am going to have to steal it and make it into a pretty diagram. And we realised when we talked, I brought it back to the office and said, look, this is the way they were talking about it, how brilliant is that? But we also realised that one of the things is that there's a flow in the other direction as well. So we are putting on the agenda nationally issues that we hope will be taken up locally. So for example, we've just started a major campaign on complaints, making sure that people's concerns and complaints are properly heard, because the system at the moment is enormously confusing. People don't know where to go. How can it be that I know if my washing machine breaks down, I know tomorrow who to phone, but if I have a problem with my GP, it takes me 2, 3, 4 days to figure out where to go. Can't be right. Can't be right that we're in a system that I know better about how to fix my kettle than I know how to fix my health and social care provision. How can we live in that kind of world? It's too confusing what we've got. And actually, unfortunately, where people do raise concerns or complaints, they're dealt with frequently ineffectively. So we've got a national overview. We've taken that issue to the network already. They're doing fantastic things with it. So Health Watch Peterborough has written to their local acute trust and said, we want every 10th complaint letter. We want to have oversight of it. And dutifully, the local acute trust gave the letters, every 10th letter. They weren't able to massage it. They literally gave them every 10th letter. Health Watch edited excerpts from those letters, took it back to the board and said, if you had a problem in this hospital, would you want a letter like this back to you? And the board were mortified. They had no idea how poor the responses were. And now that board has complaints as its #1 priority. So that is the power, potential power of Health Watch in action. This gives you, I hope you can see, a little glimpse of what Health Watch are up to up and down the country. So just to kind of pick out a couple of bits of practice, down in there they are. Down in Torbay, this is local solutions to national issues. One of the issues, as I said, was about raising awareness. Down in Torbay, what better local solution than they have a consultation caravan, wonderful thing for the southwest. Everyone's in caravans, aren't they, down in Devon? They have a consultation caravan touring the bay in order to raise awareness of Local Health Watch. So it's those sorts of local illustrations of how people are raising awareness. Up in Cumbria, sorry, not on this map, but let me give you another one. Up in Cumbria, they've been round all of the county fairs with a fabulously big marquee, giving out healthy, fruity snacks in order to raise awareness of Health Watch up in Cumbria. So they're out there, they're already doing stuff. This gives you just a little glimpse of the potential of the network. So what I'm just going to very quickly talk about, I'm not going to be able to get through all my slides, but what I'm going to very quickly talk about is actually what do people really think about health and social care. So one of our responsibilities is to always start with consumers. What do people actually really think about this? What are their actual views and experiences? And we, as I say, 48 hours ago, published our first annual report, which reports those views and experiences. What's fascinating is that the headline that is often used by the Department of Health and by politicians is about satisfaction rates. 7 out of 10 of us believe we get a good quality service from NHS and social care services. Fantastic. Looks like 70% of us are happy with what we're getting. It's often a headline that's used. But actually, if you dig a little deeper, you find a quite different story, with a shocking 1 in 3 of us having experienced ourselves or knowing somebody who's experienced a serious mistake or abuse within a health and social care setting, leaving too many of us, 1 in 3 of us, with very deep concerns over basic safety standards. And despite this, more than half of us who experience a problem not reporting it. And 1 in 4 people saying that professionals aren't really interested in what they say and do not actively listen. So how can these two things be held at the same time? How can it be that 70% are saying they get good quality service and yet 1 in 3 are saying that they know that they've experienced someone who's had a serious mistake or abuse within health and social care setting? Well, it's the difference between a first response and the deeper response. Actually, people do hold both of those views at the same time. Because we've got a free at point of use health service particularly, we tend to be quite grateful for what we're given, hence the 7 in 10. We don't want to lose our free at point of use service, hence the 7 in 10. But actually, the vast majority of us, as statistically closest to the total population as you can ever get, which is 94% of us, think that the health and social care system need to change. So this is the difference between people's initial response, which is being grateful for what we're given, and their deeper response, which is actually things need to change. And in order for them to change, we need to put people at the heart of health and social care, and that is our job moving forward. So it's about a fresh approach, really. There's a huge agreement out there in the system. Everywhere we go, we hear, absolutely, we have to put consumers, patients, users of health and social care absolutely at the heart of services. But actually, people aren't doing it, and our job is to make sure it happens. And one of the things that we do is start with people, start by actually listening to people. So the work that I'm just about to present, I'll do briefly, was work on a rights framework for health and social care. And actually, we didn't write it down. We didn't sit in an ivory tower writing down what people's experiences, what people thought their rights should be. We actually started by actively listening. So we'd had a day-long deliberative event earlier in the summer with a cross-section of the population, and we checked it out with a much bigger sample as well later in the summer. And what people came up with is 8 fundamental rights, and this is our platform for action going forward. The right to essential services, the right to access, safety, dignified quality services, the right to information and education, the right to choose, the right to be listened to be involved, and to live in a healthy environment. And it's exactly this framework that we're testing out. It's a hugely big ambition, actually. This is the vision. Somebody said to me when we were presenting it another day, my goodness, if we got all of this, what a wonderful place we would live in. And that's exactly what we're doing in this, is setting out an aspiration, a vision for the UK, for English, health and social care services. An aspiration and a platform for us both to challenge individual providers, commissioners, those regulating services, to say, how well are you doing? And specifically to enable individuals to hold those services to account, individually, but via their local health watch if that's what they want to do. So that's our starter for 10, or indeed our starter for 8, I guess, the rights framework that we're testing out with people at the moment. I won't give you the detail, but there is a lot of detail behind it about what these rights mean in practice. I'm flashing this in front of you to tempt you onto our website. So more, click on later to our website to see more. I'm sure you'd be very interested in a lot of them, like being involved, living in a healthy environment. I'm sure all of these will be of interest to you. But what's really, really important is we make this a live conversation. So we really want to hear from you about what these rights mean to you in your work and in your local community, because these rights are only going to be as good as they are put to use by all of you, by us as the Health Watch Network, but by all of you, because this is the standard that we need to hold health and social care services in this incredibly changing and challenging context that we need to hold them to account for. We've got fantastic interactive content on our website, and of course we have a conversation going on Twitter, who doesn't, using the hashtag ThinkRights. So please do get involved and let's get talking about that. And I will finish there. Thank you very much.